All right. Thanks for coming out to pitch day for 100K. It's always a great day to pitch, but I really like our fortnightly process that we have here. Today we're going to hear from Cad from Trust Health. She's right here in the room. And Nikhil from Elly Health is going to pitch to us from online, somewhere out there in the world. And congratulations to both of our founders for getting here today. We usually have 15 or 20 companies that are after each one of these spots here on pitch day. And we do put you through a bit to get here. So thanks for going through that bit and getting here. StartUpNV is Nevada's statewide nonprofit startup accelerator and incubator. We operate 7 free programs for entrepreneurs or founders, if you prefer, and 4 for-profit investment funds to make investment in these companies. Government grants and corporate sponsors support our nonprofit mission. They support it in the short term, and then over the long term, we're supported by the accelerator companies who donate a small amount of their equity to the nonprofit, and to investors in our funds who donate some of their profits to the nonprofit as well. Now we run pitch day for 100K fortnightly on Wednesdays, where companies pitch for the Q&A and to get into our accelerator program, which comes with an investment from FundNV. Now that investment from FundNV is added to by our investor syndicate. All of that money is put together and it's matched by the state's SSBCI program. So since 2021, our funds and syndicate have completed 30 transactions in 20 companies, directly investing a little over $9.4 million. Partners like GoEd with their SSBCI program and other venture firms and angels invest alongside us. That makes that $9.4 million into a total of just over $30 million since the time we started investing in 2021. That's an average, if you're counting, of about $500,000 per company, $500,000 per company direct, or $1.5 million if you include all of our partner investments in those companies as well. Now, our $9.4 million worth of direct investments to date are currently worth $27.3 million. It's a pretty good track record for a group that's been investing for just 3 years. So thanks again to our founders who are pitching today and to our investors who join us in our funds and in our syndicate. Now for the legal disclaimer, so everybody perk up for this part. The founders who are pitching today are pitching for investment from our venture funds and our venture syndicate, which comply with the SEC and Nevada Certified Investor Regulations. Now we invite the whole community to come out and attend for educational purposes, kind of like tuning into Shark Tank. That helps our whole community come up to speed on how all of this works. It's part of our mission. So once again, the pitches today are not general solicitations from the general public for investment. Now, our nonprofit work would not be possible without financial help from our grants and sponsors, the City of Las Vegas, Clark County, the Governor's Office of Economic Development, the EDA, and the USDA are our primary supporters from grants perspectives. Thank you very much to those organizations for their support. So I think we're about ready to begin. And I believe we've got Nikhil, who is going to be going first. So Nikhil, why don't you fire up your slides and start sharing them. And as soon as we see them up on the screen, I will move out of the way. Looks like you're there. So Nikhil, anytime you're ready, please.
Great. Yeah, thanks, Jeff. Hi, everyone. I'm Dr. Nikhil Pooviah, co-founder of Elly. We are a digital health startup helping life science companies support chronic disease patients. We do this with our iPhone app, whose name is Elly, and who's got a friendly voice that you'll get a chance to hear from today. Chronic diseases are the leading cause of death and disability in the US, and it's a growing health crisis, as over 133 million Americans have at least one chronic condition. Pharma treatments that are prescribed to these patients can improve their disease control, prevent admissions to hospital, avoid health impairments, and most importantly, reduce their risk of dying. But life science companies struggle with more than 50% of these patients having intentional non-adherence to their treatments. We believe this is because of 3 core reasons. Firstly, the drug education is typically via text in the form of physical patient brochures. These can be quite confusing for many patients and not tailored to all levels of health literacy. Secondly, resources and support for quality of life are missing once patients start their treatments and are back in their community. And thirdly, inappropriately managed side effects cause patients to either go back to their physician and ask to change treatments, or even stop them completely without a consultation. All of this leads to Pharma missing out on $637 billion of annualized revenue just from poor treatment adherence. And it means patients like Kiara, who you see here, will suffer from poor clinical outcomes. Unfortunately, Kiara was diagnosed with breast cancer, which requires weekly chemotherapy and daily hormone treatment. This has left her anxious, overwhelmed, and lonely. When she needs comfort and support and education, she turns to our iPhone app, Elly. Elly is a friendly persona who supports Kiara through personalized content experiences. Each day, Kiara receives new content based on her diagnosis, treatments, demographics, and preferences. Kiara starts by opening her iPhone app and viewing her Today screen and listens to a Daily Elly. The Daily Elly is a 90-second content recording that starts with a motivational story, includes a condition-specific topic like symptom journaling that you can see here, and leaves patients with an inspirational message. It's a short, bite-sized piece of content that Kiara can easily incorporate into her daily routine.
Hi, it's Elly. You are planting seeds for personal growth today. Look after them and they will continue to bloom.
Kiara can also watch exercise videos from instructors living with chronic conditions who understand her limitations. Then Kiara can listen to meditations from Alex, who had cancer as a young adult.
Each day, we'll come together to explore a fresh topic so that we can approach our day with a new way of thought, and then we'll meditate together.
Kiara can then dive into over 2,000 patient stories, so she can learn from over 100 patients like Ariana.
For me, staying mentally healthy and implementing self-love first came from acceptance.
Kiara can also check in with Elly to record her treatments, emotions, and her symptoms. By doing this, Elly provides her with treatment reminders and then personalizes a playlist of content to help address any new issues that have come up. Overall, with Elly, Kiara feels significantly healthier and happier, and has the best chance of improving her survival by having better treatment adherence. Patients who spend just 30 days with Elly improve their quality of life on average by 15%. This is a result that no other product or trial has ever achieved. Also, Cedars-Sinai recently published a phase 2 study with Elly at ASCO, which is the largest cancer conference in the world. Elly has been shown to significantly reduce patients' anxiety levels at 30, 90, and 120 days, which we're quite proud of. Elly also increases treatment adherence by 40%, which is compelling for Pharma as they miss out on significant revenue from non-adherence. So we license B2B to Pharma by selling data and content experiences. For our data license, customers like J&J pay us $50 per patient per year, and we give their oncology team unique insights on patients like in this report on the right. These insights include data sets like side effect burden, demographics, content popularity, and health-seeking behaviors. This allows them to better understand what resources to develop while anticipating and managing potential complications from patients on their treatments. Directors like Roni value working with us as patients stay on treatments for longer, meaning our team can increase their drug revenue targets. For our content license, customers like Bristol Myers Squibb pay us $5,000 per brand per month, and we give their patients custom audio content for drugs like Eliquis, which is a blood thinner. We create custom daily Elly specific for the drug, like you can see here on the right. This helps educate patients about symptom management, reducing risks, lifestyle changes, and ongoing support. Along with this, treatment reminders, tracking, and accountability is delivered by Elly. Managers like Triff love that Elly reminds his patients to take Eliquis each day. Because they're more compliant, he's already lining up other drugs in their portfolio that we plan to upsell into. Our go-to-market involves acquiring patient users through channels like hospitals, nonprofits, and academic partners. It's a flywheel for us to sign up new pharma customers, as we can show them we already have patients that are using Elly who are already on their drug, and then use a land and expand approach to upsell across 50 chronic conditions that we've created content libraries for. This means we can service a market of 20,000 drugs from a pipeline of pharma customers that you can see here. Conservatively, we believe our SOM is going to be upwards of $100 million from 2 million patients within the next 3 to 5 years. We came to these market opportunity calculations by using our pricing of $50 per patient for close to 7% of total patients with a chronic disease for which we have content libraries already produced. Unlike competitors, our app has a rich audio experience, content on patient education, and better accessibility. Compared with chronic disease coaching companies like Livongo, Amada, and Lark, Elly is purely digital, without relying on human intervention or connected devices, so we believe will be more scalable. Compared with consumer content companies like Calm, Headspace, and Big Health, Elly has disease-specific content, and we collaborate with contributors who have had a chronic condition, ensuring our content is more relatable as opposed to just meditation and sleep. Compared with digital therapeutic companies like Pear, Akili, and Click, Elly is being commercialized already without needing FDA regulatory requirements and approvals. Since our launch, we have over 12,000 users who are all highly engaged with Elly. Our 1-month retention is 98%, with an average Elly user listening to 14 minutes of total Elly content per day. And we signed up some reputable customers, including the likes of J&J, BMS, and Pfizer. We've already hit 300K in total revenue to date, which includes 15K in MRR, and have a further 1 mil ARR in our pipeline from business units like Novo Nordisk's Ozempic treatment. We are a team of experienced operators who have co-founded, built, and scaled successful startup companies that are valued at over $500 million. I co-founded Asara Health, which is a startup in the coaching space. It's a $50 million company. It's profitable and doing quite well. I'm also a venture partner at Black Nova VC, where I lead their healthcare deals, and I've experienced designing and running an accelerator myself. I was the MD of CancerX, an accelerator solving Biden's cancer moonshot goals. I've led digital innovation at Moffitt Cancer Center, so I've experience also as a buyer. And I've looked after thousands of cancer patients as a radiation oncology physician, which led me to start Elly with my team. Our core team is composed of serial entrepreneurs, physicians, patients, and clinical content experts. We have domain expertise selling into pharma, having secured large enterprise contracts for other companies in the past. We are in the process of raising our $2.5 million pre-seed round through a convertible note. The terms are quite favorable, with a 20% discount, $5 million pre-money valuation cap, and 2-year term length. We've already closed $2 million already from some great strategic investors, including Google, Bayer, Snapchat, Morgan Stanley, and recently, Generator and Battleborn Growth in Las Vegas. This use of funds extends our runway for 12 to 18 months and will be going primarily towards product development and content production so we can launch our conversational AI product. This will in turn help us create new content, deliver two-way voice interactions, and capture new datasets to in turn commercialize with Pharma, which I'll be happy to go into more detail in Q&A if of interest. I'm Nick, co-founder of Elly. We're helping chronic disease patients live healthier and happier, and I look forward to your questions. Thank you.
Thank you so much, and excellent timing.
All right. Thanks, Nick. Really appreciate it. Interesting product. Can't wait to hear what happens next. 2 fascinating presentations today. And thanks to all of our participants and our viewers out there, that whether you're watching live right now, or whether you're going to be watching this back on YouTube later, thanks for tuning in today. And just a few program notes as we wrap up. Investors, if you're curious about how to get involved in that, turning $9.4 million into $27 million, also reach out to us on StartUpNV.org, or just follow the investor path instead, and fill out a couple of forms, and one of us will get back to you and tell you how it all works. And thanks again to the founders who pitched today. Thanks so much. Very, very interesting. And everybody who listened in and asked questions. And to our investor group who's going to be watching this later, it's going to be a tough one to go through. So we'll see you back here again in 2 weeks, and with 2 more awesome Nevada founders and companies. And until then, take care of yourself, and if you can, someone else too. See you in 2 weeks.